Hello everyone, this is MBBS Gallery. Today our topic is one of the most important one, the facial artery. Okay, the facial artery, it is actually the main artery which supplies the face. So it is also called chief artery of the face. And as it is an artery, we have to see about their origin, course, termination, branch, and along with clinical significance. So origin is it is actually arises from the external carotid artery. Here is the external carotid artery. This at the level of greater carnua of hyoid bone. At the level of greater carnua of hyoid bone, the facial artery arises from the external carotid artery, and then it has a looped course. So it after emergence, it looped around the submandibular region, and it enters the face by winding around the lower border of the mandible. This is the mandible. It enters the face by winding around the lower border of the mandible at the antero-inferior angle of the masseter. So it then enters into the face and ends in the angular regions. So its termination. Let us see about its termination. It is actually have a tortuous course because we have a lot of expression in our faces. During that times, it has to be resist against that movements. So it has a tortuous emergence. It turns upwards, forwards, and ends in the angular region. This is so. That's why the terminal part of facial artery is angular artery, and it has a lot of branches. Let us be divided the branches at two regions. They are one is a cervical part and another one is a facial part. Let us see it in clearly, little more clearly. The facial artery, the main arterial supply to the face is by facial artery. Hence, it is called chief artery of the face. So, the origin and course. It arises from the external carotid artery. We know that in the neck at the level of greater cornu of the hyoid bone, and after a looped course in the submandibular region, it enters the face by winding around the lower border of the mandible at the antero-inferior angle of the masseter by piercing the investing layer of deep cervical fascia. This is about origin and course, and let us see about the terminations. In the face, the artery passes tortuously, first upwards and forwards to the point 1.25 cm lateral to the angle of the mouth. This is the angle of the mouth, and 1.25 cm besides, and that is lateral to the angle of the mouth, and then it ascends along the sides of the nose to the medial angle of eye, where it ends by anastomosing with the dorsal nasal branches of the ophthalmic artery. This is the dorsal nasal artery, which is a branch of ophthalmic artery. Here it forms an anastomosis. The end of the facial artery is angular artery, which forms an anastomosis with the dorsal nasal artery, which is a branch of ophthalmic artery. This is actually the termination. So the terminal part of the facial artery is the angular artery. So let us see about the branches. So the branches includes, as we know that, the cervical part 1, and the facial part the 2. The cervical part includes 4 divisions. So ascending palatine artery, tonsillar artery, glandular branches, and submental artery. The ascending palatine artery, which supplies mainly the palate, and tonsillar artery, which supplies mainly the tonsils, and glandular branches supplies the submandibular gland, and the submental artery, which supplies the mylohyoid muscles, submandibular and sublingual salivary glands. Facial part. The facial part includes inferior labial artery, superior labial artery, lateral nasal artery, muscular branches. The inferior labial artery, labial means mouth, lip. So the inferior labial artery supplies the lower lip, and superior labial artery supplies the upper lip, and lateral nasal artery, which supplies the ala and dorsum of the nose, and muscular branches arises from the posterior aspect of the artery. So let us see about, these are all about the branches, and let us see about the clinical aspect. Since the facial artery is richly vascular, the wound of the any wound in the face bleed profusely, but fortunately they heal quickly. Thank you.